Hey everybody, my name is Dr. Daniel Choi here from North Texas Dental Surgery Wisdom Teeth and Implant Center, and I wanted to talk to you guys today about a topic that's very near and dear to my heart because I see a lot of patients being taken advantage of. And that topic is gum disease and how a lot of patients are being over-treatment planned for it and therefore being charged a lot of money unnecessarily. And sometimes they are also having to go through more extensive and invasive procedures. So I prepared a little something in this video to kind of tell you guys about, hey, what is gum disease? What are the treatment options? How to look out for gum disease so you aren't overly diagnosed it, because a more informed patient is going to be less prone to being overdiagnosed or being told that they need this treatment. And also other treatment options available, kind of going into a little bit more details about what to be looking out for to make you as informed a patient as possible. So let's go right into this. So gum disease. All right, so what is gum disease? Well, gum disease is basically a situation where bacteria in the form of plaque or tartar, and you see about this on commercials on TV all the time, whether it's a toothbrush or toothpaste commercials, where they talk about that plaque or tartar gets underneath your gums and therefore releases toxins that cause your gums to be inflamed and eventually for you to also lose your bone. And the sad thing about this, unfortunately, is that gum disease is actually the reason that most adults actually lose their teeth. And it's funny because most people usually think it's cavities, but it's actually gum disease. And just letting you know also, gum disease is just the layman's term for periodontal disease. So what exactly is gum disease here on this model? I want to show you this real quick because a lot of times patients don't even know they have gum disease, right? And they say, well, doc, I don't feel any pain. Well, there's so many other situations in life that we, might not have pain. You could have high blood pressure. You can have high cholesterol. You could, have many different situations in your life, like cancer even, God forbid, where you can have a situation where you don't feel anything necessarily. So when we take a look at this model, so we don't typically use pain as a precursor as to tell us whether we have a disease or not. But when you take a look at this model, this hypothetical patient just has their teeth and gums, doesn't notice anything wrong. And in a healthy case, what we see is we see the teeth and their roots are embedded in a healthy amount of bone. Now, when we look at a disease case, here on the other side, what we're seeing is that on this side we see a lot of bone loss. And again, as I explained earlier, that is due because the bacteria releases toxins that causes that bone loss. So I like to tell patients it's like that the toxins that are being released by the bacteria are essentially just melting away that bone. And over time, you lose enough bone and you start, getting loose teeth here. And so that's how you lose your teeth. So that's basically periodontal disease in a nutshell. So how would we diagnose gum disease? Well, we do two major things. We examine your x-rays and we also measure your gums. So taking a look at your x-rays, I know a lot of times you guys go to the dentist's office and you don't even really know what you're looking at. And, I don't blame you, because if I was to look at an MRI, if I went to the hospital, I wouldn't know exactly what I'm looking at either. So my purpose with this little segment of the video is to kind of, help you to be able to see what might be going on within your mouth. So what we see here is this is what typically healthy bone and gum looks like. The bone is right around the what we call the crown of the tooth, and the crown of the tooth is the visible part of the tooth that we see in your mouth, because obviously we can't see our roots, right? So your gums are surrounding the bone, so you can never see your bone. But on this x-ray, we can see that the bone is pretty close to the crowns of your teeth. Now, if you have mild periodontal disease, it typically looks like something like this. You might see a little bit of bone loss going on. I know to the untrained eye, it's going to be a little bit harder for patients to really see, but usually you see a little bit of bone loss compared to this previous x-ray I showed you where this patient has no bone loss. So moderate periodontal disease is basically when the patient has a little bit more bone loss. And if you can compare, I said the crown of the teeth, right? So that's up here. And you could see that this patient's lost a little bit more bone. So, this patient actually kind of skirts between moderate and severe periodontal disease. But this is, again, what we see. We see more bone loss. And then in a case like severe periodontal disease, what we see here is we see more bone loss. In this case, this back molar you see this area of black. That's really what we're looking for, because when you lose bone, the areas next to the root surfaces become more darker. So why do we see darker areas? Well, when the disease is when the bone is diseased due to the periodontal disease, then what happens is the bone is lost. And when the bone is lost, it turns from that nice white, dense looking material to a darker, shade of gray over here. And that's what's indicative of bone loss. So in this x-ray, this patient has isolated areas of severe bone loss. By the way, I did not place that implant on that patient. I don't know who did, but this is a terrible implant. And this is another example of severe bone loss. We can see that, where the necks of the teeth are, look at where the bone is. And you see these areas of darkness around the roots. And that's what's very indicative, telling us that this patient has a very severe case, even what we call periodontal abscesses. And I won't really talk about that in this video, but I'll try to keep it simple. But you can definitely see areas of severe bone loss happening within this patient. Here's another example. This patient came to me for a consult regarding implants, and unfortunately somebody placed an implant on him when he had active periodontal disease, and therefore is about to lose this implant. But you can see on this x-ray that this patient has severe bone loss. You could see that the bone is nowhere near the crown of the tooth. And so this patient, again, has severe periodontal disease. And that's what you would be looking for in these cases. And in these severe cases, unfortunately, sometimes you can't even treat it with, gum surgery. Sometimes you're unfortunately just going to lose the tooth. So we said one way to diagnose whether you have periodontal disease is to look at the x-rays. The other way is also measuring your gums. So you're probably familiar when you go to your dentist or your hygienist, are always measuring your gums with this little periodontal probe here. And it has little markings on it that basically tells us how much separation your gums have from the root of your tooth. The deeper that your probe can go, then that means that we have more separations of your gums due to the inflammation. So the deeper your probe goes, it tells us the worse your periodontal disease is. If you have only 2 to 3 millimeter probing depths throughout your mouth, then you have a pretty healthy mouth. But if you're probing deeper and you have anywhere between 5, 6, 7, and anything further than that, then you just definitely have periodontal disease. So this is just a real life photo of what a periodontal probe looks like when measuring your gums. So when we're measuring your gums, again, how deep your measurements are, they tell us how bad your periodontal disease is. So 1 to 3 millimeters is healthy. 4 millimeters is where you start to see things maybe that patient potentially needs to get a deep cleaning. But not necessarily. But if we do see 4 to 5 millimeters with bleeding kind of generalized throughout your mouth, then yeah, that patient is definitely leaning more towards like needing a deep cleaning. And if that patient has 6 millimeters plus, then that patient, they'll probably start out with a deep cleaning, but honestly, it's not going to be good enough. So that patient will most likely have to go visit a periodontist to look at some periodontal surgery options. So these treatment options that we were talking about, again, a deep cleaning versus going and visiting a periodontist to get some sort of periodontal surgery. And a deep cleaning, when we say the scaling root planing, that's just the technical term that we use for a deep cleaning. So treatment of gum disease. So that deep cleaning I keep talking about. So what we typically do is we numb up your mouth and we try to get as deep underneath your gums as possible to remove that bacteria. The problem is that when your gums are like that and we numb you up and we try to get our instruments as deep underneath there as possible, we can only typically get to about 5 millimeters depth. Any deeper than that, and our instruments can't really see what's going on down there or reach far enough. So we're not really able to remove all your bacteria. So because a lot of that bacteria resides underneath there and then can multiply, we're not really doing you a long-term, service. Okay, so if the deep cleaning is not an option for you because your measurements are too deep and you've lost too much bone over the years, then you need to look at another option, and that's what we call periodontal surgery. And I know once we say surgery, it sounds scary, but I'll go into a little bit more detail as to why it's not that bad. So we have two options. We have the traditional osseous surgery, and honestly, it is more invasive, but it is tried and true. We've been doing it for over 60 years, it does tend to have some side effects such as severe root sensitivity. We also can regrow bone in certain instances, but that can definitely add a lot of cost onto your procedure. Option number 2 is laser gum surgery, and that was invented about 10-15 years ago with a procedure called LANAP. They use a specific wavelength laser to go in there and destroy the bacteria that's underneath your gums. And also, it can regrow bone in certain instances. So it's a great, less invasive option to achieve the same thing of reducing the bacteria underneath. Now, this is laser gum surgery, so I'll let you watch this animation real quick.
The periolase fiber, about the size of 3 human hairs, is gently placed between the gum and teeth to remove the diseased tissue inside the pocket. This laser fiber selectively removes the diseased tissue and kills the germs that cause gum infections, while leaving healthy tissue unharmed. This also improves access and visibility for better removal of the barnacles of calculus from the surface of the teeth. Tiny ultrasonic root cleaners vibrate these deposits away and flush them out with antibacterial rinse. Once the surfaces of the teeth are clean, the laser is used a second time at the bottom of the pocket to remove any remaining debris and to sterilize the pocket, soft tissue, root, and bone. This also causes the blood to become sticky, creating a seal around the teeth. Once the seal is formed, we have created a clean, closed, and stable environment for healing to begin. We have tipped the scales in favor of regeneration versus degeneration.
All right, so when you compare those two options, obviously one sounds a little bit better because, you know, osseous surgery is more invasive. Laser gum surgery, we don't have to peel your gums back. But osseous surgery, its benefit is it's usually a little bit cheaper if the dentist doesn't add a lot of bone grafting, and that is a big if, okay? So that is where you have to be careful because a lot of dentists or periodontists are going to add on a lot of expense. And I'll explain a little bit more in this video where that might not even make a difference, you know, all that additional bone grafting because you might not even need it. Also, laser gum surgery is less invasive and less painful, and it has a quicker recovery time. So that's where you get the added benefit of the laser gum surgery. It is a bit more expensive than traditional osseous surgery. However, you don't have to pay for extra bone grafting with the laser gum surgery. So in the end, when you visit some of these different dentists, you actually will probably save more money with laser gum surgery. So what you need to watch out for. So as I mentioned at the beginning of the video, a lot of times there's dentists and dental hygienists and they'll tell you that you have gum disease and you need a deep cleaning. Guys, I've been practicing as a periodontist here in 2020. This is my 9th year of practice. I used to be an independent contractor surgeon. I used to, I've gone to 100 different dental practices in my career, and I've met a lot of people. I've seen a lot of dental hygienists, and I've seen how some of these corporations talk to these dental hygienists in regards to what their expectations are, and they want every patient that goes into that office to get a deep cleaning, and honestly, it's unethical. And so this is the reason I made this video, because I want you guys to be aware of if you really do need a deep cleaning. And I'm not saying that these dental offices are all out to get you to make sure that you pay a little bit more money or use all your insurance benefits to get this deep cleaning. I just want to make sure that if you need it, then you actually do need it, and that you are as an informed patient as possible and you know basically all the criteria that you might have within your mouth, versus just going into your dentist and blindly accepting the treatment that they offer you. So some things that you can ask for. Do you have 5mm probings or greater? Do you have a lot of bleeding in your mouth when they probe your gums? So you can even ask to, have a handheld mirror and be looking at your mouth when they're probing your gums. Are your gums very sensitive when they probe? Because that might be an active sign of inflammation. It's like touching a bee sting on your arm. The more you touch it, if it's inflamed, then it would obviously be sensitive. So not only does that apply for your measurements, but also ask to see your x-rays. Do you see any bone loss? So these are certain things that you can ask for. And granted, even if you do know all these things, sometimes there are patients that still do need deep cleaning. So unfortunately, there is not a very clear-cut answer to give somebody as to whether they need a deep cleaning or not. But if you have any doubts about this, then you should definitely go and seek a second opinion. Unfortunately, dentistry can be very subjective sometimes, so it definitely could be a benefit to go seek a second opinion. And now, let's say that you've been told that you need like some sort of surgery, periodontal surgery within your mouth. So what are some things to be looking out for? Well, there are some dentists out there that if they tell you that you need that osseous surgery, and again, osseous surgery is when they pull your gums back and clean out the bacteria, remove the diseased bone. Well, they may tell you that you have a lot of bone loss and you need to add more bone. Well, if somebody tells you that at the time of your consultation, a lot of times it is extremely difficult to be able to tell whether a patient truly does need bone grafting or not. So I would be a little bit wary of situations like that because there are certain offices or dentists which then start adding what we call bone graft and membrane onto each tooth within the mouth. And so what that really does is that drives up the cost of the procedure and obviously the expense for the patient. And so, you know, I personally in my career have seen a lot of patients that have been diagnosed with that and they get these ridiculous $15,000 to $20,000 treatment plans. And it's very unfortunate because I really feel that it's an abuse of the system and an abuse of patients' trust. So, you know, if you feel that you get this type of treatment plan, it might be a good idea to go seek a second opinion and really ask whether you truly need all that extensive bone grafting because I don't see this all the time, but I have seen it many times in my career. Also, if you are getting laser gum surgery, so what are some things to be aware of in those situations? Well, be wary of dentists who tell you that they can rebuild all the bone with the laser gum surgery. I think a lot of patients do a little research online and they say, oh, can Lanap rebuild all the bone that I've lost? And as amazing as Lanap is, and it can give you great results with less invasive procedures, anybody that has a lot of experience with laser gum surgery would be lying to you if they said that they can rebuild all the bone within your jawbone all the time. I find that it is pretty unpredictable. I find it has to do with patients' oral hygiene, basically the genetics, basically how they lost the bone, how long they've had the periodontal disease. So there's so many different factors involved in regards to, you know, trying to predict whether a patient is going to get bone loss, bone growth. And then also in certain cases, another abuse that I've seen with patients is when patients obviously would love to try to save every tooth that they can, but a lot of times we see patients that have extensive bone loss where, you know, honestly the best treatment option for that patient would be an extraction and maybe looking at an option like an implant or a bridge or an all-on-4 if enough of their teeth are, you know, severely diseased. So whenever a patient is being told that laser gum surgery is a good option for that patient, sometimes some doctors basically get a little too overzealous when they tell patients in regards to the ability to save the patient's teeth and how much time that a patient can buy from having this laser gum surgery done. So those are some of the other things to be looking out for if you're going to have laser gum surgery. My final tips in regards to gum surgery in general or periodontal disease treatment. This disease occurs due to bacteria, right? So with the bacteria, us having to go in and remove that bacteria is half the battle. How you take care of your teeth after in regards to extensive brushing 2 to 3 times a day, using mouth rinses, using floss, using interproximal brushes. And I know that sounds like a drag, but if you want to hold on to your teeth and, you know, maintain the aesthetics of your mouth and not have to undergo something like dental implants or a procedure called all-on-4 or having dentures, I mean, it's just well worth the investment. But you just need to make sure that you're dedicated to it, because I like to tell patients that taking care of your teeth is like losing weight. You can go meet a trainer, train with that person for 6 months who will also help you with your diet. But if you lost all that weight that you wanted to lose or gained all that muscle that you wanted to gain, if you don't do a good job of taking care of your teeth after your procedure, it's all for nothing. Just like if you were to, not take care of your diet and your exercise afterwards, you can like just regain all that weight that you had lost with your trainer. So the dentist that is providing the service for you, your periodontist, that's only half the battle of doing the surgery. So there is no cure to periodontal disease. It is just a situation like hypertension, diabetes, where we just try to manage it. So just understand a lot of this is going to be on you also to take care of the results that you get. And if you don't do a good job of taking care of, your teeth, and you have old habits that come back and you never floss your teeth again, or you brush your teeth once a day, or you go to the dentist every 2 years, you're not going to maintain good results, and the bacteria is going to come back and then start reaccumulating underneath your gums. And then it's just going to be, you're going to find yourself in that situation 3, 4, or 5 years down the road. So, this is just something that I am very passionate about because, again, I've seen tens of thousands of patients over my 9 years of private practice. So I want you to have a good result. I want you to understand what periodontal disease is and know how to look for it so that if you go to the dental office that you aren't going to be abused by the system where somebody tries to over-treatment plan you with a deep cleaning, or if you legitimately do need gum surgery, that nobody's going to try to add on all these adjunctive services where they just keep on trying to like increase your bills. So again, I hope that you found this video useful. If you have periodontal disease or you know somebody that is getting diagnosed with it, I would definitely have them watch this video so that you can be as informed as possible. And again, if you have any questions, and if you're in the North Texas area, please feel free to come in here for consultation. But even so, if you have any other questions and you're not in this area, go and seek a second opinion. So I really hope that I was able to provide you guys with some information in this video, and best of luck to you guys. Thanks.